My name is Ashton Martinez, and today I'm going to be talking to you about triple-positive breast cancer. What is triple-positive breast cancer? So, triple-positive breast cancer is when breast cancer cells express estrogen receptors, progesterone receptors, and a larger than normal number of HER2 receptors. What is HER2? So, HER2 stands for Human Epidermal Growth Factor Receptor 2, and it's a protein that promotes the growth of cancer cells. HER2 positive breast cancers are known to be much more aggressive and more likely to recur than HER2 negative breast cancers. And it's important to note that about 25% of all breast cancers are HER2 positive. How do we test for triple positive breast cancer? So we can do this in two ways. The first way, we can use immunohistochemistry, which is a process that selectively identifies and measures the amount of certain proteins in cancer cells. And we can use this process for estrogen receptors, progesterone receptors, and HER2 receptors. The second is fluorescence in situ hybridization, or FISH. And this process looks at the number of copies of the HER2 gene in the DNA sequence of breast cancer cells. And it's important to note that this particular process is only for HER2 receptors. It does not test estrogen or progesterone receptors. Here's a little visualization of those two processes. As you can see, FISH technology uses a fluorescently labeled probe, and immunohistochemistry uses primary and secondary antibodies along with a colored product. Treatments and overall outlook. So, general treatments for triple-positive breast cancer include surgery, which discusses more about breast conservation versus getting a mastectomy. And then, of course, radiation and chemotherapy, which are both pretty standard for cancer treatments. Then we have targeted treatments, which are treatments that work from the outside of the cell to block chemical signals that promote tumor growth. And these treatments include trastuzumab, which is also known as Herceptin. And this treatment blocks cancer cells from receiving chemical signals that spur their growth. We also have adatrastuzumab emtansine, or Kadcyla. And this is a treatment that combines trastuzumab with emtansine, which is a chemotherapy drug. And this treatment is used to shrink tumor cells as well as extend patient survival rates. We also have neratinib, or Nerlynx. And it's important to note that this particular treatment, instead of working from the outside of the cell like the rest of our targeted treatments, actually works from the inside of the cell to deal with chemical signals, and it aims to reduce breast cancer recurrence. We also have pertuzumab, or Perjeta, and this is a treatment that works very similarly to trastuzumab. The only difference is it attaches to a different part of the HER2 protein. And then lastly, we have lapatinib, or Tykerb. And this particular treatment blocks proteins that cause uncontrolled cancer cell growth, and it is used to delay disease progression. In terms of overall outlook, because we've had such large advancements in targeted therapies like the ones that I've talked about above, they have greatly improved the outlook of people with triple-positive breast cancer. So the prognosis is usually pretty good at this point, though it does vary depending on the patient. Thank you so much for watching, and please let me know if you have any questions.